Hi, we really need to have another conversation about implants. Because every time I turn around, somebody's talking about doing implants, doing more and more implants. Implants have become the solution to almost every problem in dentistry. And I'm here to tell you, they're not the solution for everybody. Not for everybody. You know, I'm sort of developing a reputation as the one that goes around bashing dentistry. That's just not true. I'm not here to bash dentistry. I'm just here to let people know that no matter what they do, no matter what they put in their mouth, there are going to be repercussions. And unfortunately, many dentists do not tell the patients what the repercussions are, especially the bad ones. Now, it's not that they don't want to. It's not that they're bad people. It's that many times the dentists themselves don't even know what the repercussions are. It's never been presented to them. They never researched it on their own. So they take the information that they've been given and they pass it on to the patient. And it's all just good news. Well, it's not all good news when it comes to implants. Well, let's back up a little bit here. You need to have a conversation about the immune system. How does our body protect ourselves from things that are not good for us? We've got white blood cells, not just any old kind of white blood cells. We've got all kinds of different kinds of white blood cells. Yes, some are the lymphocytes. Those are the fighter cells. We have monocytes. We've got macrophages. These are like super educated white blood cells. If you could compare it to everyday people, there are some white blood cells that graduate from high school and are very good workers. There are some people that want to go on to college. They want to get an advanced degree. Maybe they even want to get a couple of PhDs, you know. Some of my friends are like that. They've got lots of letters after their names. Well, white blood cells are like that also. Some of them are highly educated, highly specialized. And these white blood cells have one major job, and that's to recognize self from non-self. That's how your body is protected. That's how your body is protected from bacteria, from viruses, mold, fungi, yeast, you name it. All the other things that in a very small amount wouldn't cause us a lot of harm, but in large amounts can cause us a lot of harm. So our white blood cells, which is part of our immune system, is very educated to recognize self from non-self. So let's look at the lymphocytes. The lymphocytes are the ones that are I guess you could say after high school, they took a 1 or 2 year course in specializing in flagging. They float around the bloodstream, float around the body, and every time they see something that is not self, they stick a flag on it. And that alerts the other white blood cells to come and get rid of it. Well, how do the white blood cells, these lymphocytes, how do they know if something is self or non-self? Well, this is here's a big word coming up. It's called the histocompatibility complex, or HCG. Every cell in your body has a histocompatibility complex marking on the outside. It's kind of like having a license plate or a thumbprint that says it's you. It's got your protein, your genetic code, your makeup. It's all about you. So, if a lymphocyte is floating around and it sees a bacteria that does not have your HCG on it, it will flag it, tell the white blood cells that are advanced to come and get rid of it. That's how one of the ways, it's not how, but it's just one of the ways that your immune system protects you. So again, the primary purpose of the immune system is to recognize self from non-self. That can be if it's bacterial, that can be if it's non-bacterial. What if you were to breathe in a lot of dust? You've decided you're going to go up to the attic, you're going to clean out grandma's cabinet, and you're looking at things that are 100 years old and there's about an inch of dust on it. And while you're looking at all this stuff, tons and tons of dust is going up into your respiratory tract. It's not going to take long for you to do Hatchoo, which is your body's mechanism for getting rid of it. Well, that Hatchoo, that sneeze, was set up way before you ever thought of sneezing, was set up by the lymphocytes when they recognized the dust and they said, this is not self. Okay, so now let's advance this back into dentistry a little bit. When somebody says you can simply put in an implant to replace a missing tooth, well, they're usually talking about screwing a piece of titanium into the bone. Now, you notice I hesitated a little bit when I said bone, because we think, most people, they think, okay, bone is a hard substance. It's kind of like a 2x4, and you can take a nail and bang it into the new 2x4, and it's in there nice and solid. But our jawbone is not like that. As a matter of fact, most of our bones are not like that. You've got cortical bone, which is the hard bone that's on the outside, but on the inside, you've got softer bone that's called bone marrow. When you put an implant into somebody's jaw, you're tapping it or screwing it into the cortical bone. Then it kind of goes through an area called the bone marrow that's much softer. And then it's supposed to embed itself down in the cortical bone on the other side. So you've got this in-between zone that is not nearly as hard as the cortical bone on the outside. That in-between zone is loaded with red blood cells and white blood cells. That is called the bone marrow. And the majority of your red blood cells and white blood cells are born in the bone marrow. I kind of think the bone marrow is more part of the circulatory system than it is the skeletal system. The cortical bone, the outside bone, yeah, that's part of the skeletal system. But the inside, where all that action is going on, nah, that's part of the circulatory system. So, we've got this brand new implant that has been screwed in by Dr. Dentist Wonderful. He wants to make you happy, and he's now screwed in or tapped in this implant, and it's now in the middle of the bone marrow. And we've got a whole bunch of newly educated white blood cells who have memorized your HCG, in other words, your histocompatibility complex. They know your license plate, they recognize your cells, and as soon as they see that implant, it looks like the Titanic to them. Whoa, what's this big piece of metal doing here in the happy land of bone marrow? And so now a signal is sent immediately to the brain that there's a foreign invader in site number, I don't know, let's pick a number, site number 19. That would be your lower left first molar. It's probably one of the most common places that an implant is placed, right over here. So as soon as that implant goes in, the white blood cells start to alert the brain, telling them there's a foreign invader there. The brain then sends signals to the spleen to mature some more cells, send lots and lots of white blood cells to try to figure out this foreign invader. Well, this foreign invader is really big, and there is such a thing as limitation of matter. In other words, white blood cells can only do so much to get rid of an invader. You can sneeze it out. You can blow it out with cilia. You can attack it with white blood cells that will produce lysosomes and enzymes that will digest it. But we're talking about a pretty big implant. Most implants are about, maybe almost an inch long, and some of them are maybe even a half inch in thickness. Well, that's a pretty big piece of metal for your white blood cells to attack and push out. And most often they cannot do it. So, what happens? Nothing. The white blood cell lives about 7 days. After 7 days, they're on their way out. They probably call some more white blood cells. They live about 7 days trying to fight the Titanic. And when they're on their way out, they call some more white blood cells. And so this goes on day after day after day. White blood cells live 7 days. Every 7 days, new batch is sent to the area. So what's so bad about that? Suppose you've had this implant in your jaw for a good 5-10 years. Your white blood cells have been trying to get rid of it for 5 to 10 years. Your white blood cells have been trying to get rid of this implant for 5 to 10 years. Almost like trying to get rid of a relative that's stuck in your house and refuses to leave. It can be very tiring. They're trying to get rid of this. They cannot. And you've been using up white blood cells day after day, year after year. Every 7 days, fresh batch. So then you get into an elevator. Somebody comes in behind you. The elevator door closes. Achoo! And they sneeze almost right in your face. Now, some people are good at covering themselves up when they're going to sneeze. Some people just let it fly. And so now we've got these little hepatitis C germs, bacteria, viruses, who knows what this person had. And these little particles are floating through the elevator and now entering into your respiratory tract, especially if you take a nice deep breath. Oh yeah, you got them all. They're all in there now. Bacteria, viruses, yeast, fungi, they all come in through the nose and into the lungs. Once those little creatures are in your lungs, the white blood cells in your lungs then have to decide self, non-self, self, non-self. What are they? And then they have to decide how to get rid of them. So suppose some hepatitis C just came into the right bronchi. Red alert, hepatitis C, right bronchi. Message gets sent to the brain telling them that there's definitely a foreign invader in the right bronchi. Another message gets sent to the spleen telling them to send 10 million white blood cells on the double to the right bronchi. Hepatitis C. What? What did you say? Did you say 10 million white blood cells to the right bronchi? We can't do that. We've been fighting this implant in tooth number 19 for 15 years now. We've used up all of our white blood cells. Now we've got some immature little fellows over here. They haven't quite graduated from Spring University. But you know what? They're willing and able, and they would like to have a crack at the job. Do you think that's going to cut it for the hepatitis C that you just breathed in? Maybe, maybe not. But it's a choice you get to make. It's not a choice that another dentist should make for you. It's a choice that you should make. It's your immune system, it's your body, it's your life, and you don't know how many years you have. You certainly don't know how many good years you have. You're the one that needs to make the informed decision. Do you want to use up your white blood cells trying to get rid of an implant, or would you rather save your white blood cells for when something important comes down the pike, like hepatitis C, cancer, who knows, pneumonia? Well, it's a free country. I'd rather save my white blood cells for something like hepatitis C, cancer, pneumonia. But now that you know and you're an informed consumer, you can make the decision. So why is it that so many people are getting implants and the implants are not falling out? Well, in order for me to explain that, I have to get a little historical here. I have to go back to when they first started doing implants. Believe it or not, I was a dental assistant back then. We're talking about the 1960s. They were doing them before then, but they started to get popular around the 1960s. The big problem they had with dental implants in the 1960s is that they never lasted. After 5 to 10 years, they were lucky if you got 5 years out of it. It would be a miracle if you got 10 years out of it. But what would happen is the body would finally send enough white blood cells to that piece of metal, dissolve enough bone around that piece of metal, and literally push the implant out. So the big problem we had with implants when we first started doing them in dentistry was that the implant would get loose very quickly. That doesn't happen today. Why doesn't it happen today? Why is it that when they put implants in, now they're successful for 10 years? Maybe even longer than 10 years. Why is that? Well, it's because they've decided and they figured out that if they put graft material into the hole before they put the implant in, or shortly before the implant goes in, if they put graft material in, the graft material gets hard and the implant lasts longer. Sounds like a good plan. Why is that? Why is it that if the immune system and the white blood cells are trained to attack anything that's not self, why do they not attack an implant with graft material around it? Well, to explain that one, I'm going to have to give you a little analogy. Anybody ever try to put a fence around their property? Well, almost everybody knows that if you take a wooden picket fence and you dig a hole in the dirt and you shove your post in and you pack the dirt in as tight as you possibly can, that post might hold up for a couple of years. So you go ahead and build your fence, and every 10 or 15 feet you've got another post. Well, almost everybody knows that after about 10 years, you're going to take a look at that post, and the wood that is in the dirt is going to be eaten up. It's going to be soft, it's going to be mushy, it's going to have a very soft consistency to it because the bacteria that are in the dirt will actually be eating up the wood. Now, if instead of putting the post directly into the dirt, suppose you dug a hole and poured concrete in first, and then put your post in. Now that's going to last you a lot longer. Why is that? Because the bacteria can't get to the wooden post. They've got to go through a foot of concrete. They can't do that. It's the same kind of analogy in the mouth. The bacteria, the white blood cells, they can't eat up, they can't attack a metal post that they can't get to, that has graft material all around it. So what are the materials they're using for graft? Are they pouring in concrete? No, but close. Artificial bone, called artificial hydroxyapatite crystals. That's one of the materials they're using for graft material. They're also using cadaver bone. Well, that's interesting. They're taking somebody else's bone, a dead body's bone. I'm assuming they sterilize it. As a matter of fact, I know they sterilize it because they advertise that they sterilize it. They sterilize this bone, and when it's sterile, then they put it into your body. Well, that's non-self also, so eventually your immune system is going to become either exhausted or is going to be successful at getting rid of the cadaver bone. All kinds of things they're using as graft material. They can actually take bone from your own hip, from your chin, from the side of the angle of your mandible, and transfer that to the site. Well, that sounds like it might be okay because it's your own bone. It's not a foreign substance. That's true. That might be okay if the surgeon was fast enough. Bone needs to have a constant supply of oxygen. As a matter of fact, a bone cell can only survive 34 seconds without oxygen. That's not a lot of time. So if that bone is transferred, taken out of one part of the body and put into another part, the surgeon's got to do it in 34 seconds and restore circulation to the area. Most surgeons work with a material called epinephrine. It's something that they put in the Novocaine that they give you. Well, epinephrine causes the blood vessels in the area to contract. The blood vessels contract, causing the smallest of the blood vessels, which are the capillaries, to close off completely. And so now those osteocytes, those bone cells, are not getting any oxygen whatsoever. And if they are getting some oxygen, as the surgeon chomps away and slices away and shivers away and drills away, and then gathers up enough bone to put into another site, those cells are probably going to go without oxygen for longer than an optimal time. So, there really aren't too many things that you can put around an implant to make the implant any healthier for the body. Now, some of you are probably thinking, well, what about the new implants? The Zirconia implants. Zirconia is a very interesting material. It's a crystal. It's a crystal that's actually man-made. They take a rod of zirconium metal, zirconium, and they heat it under a tremendous amount of pressure and high temperature. When they get to a certain critical point, pop, the zirconia turns into a crystal. Zirconia. Zirconia is a very interesting crystal. It doesn't behave as a metal, it does not transfer electricity, it does not transfer heat, it doesn't oxidize, which means it doesn't rust. So for the most part, your body likes zirconia. Zirconia would probably be okay as an implant material. In fact, I've always thought the best implants would be something like ruby or diamond or crystals, something that the body sees as relatively inert. So I really don't have too much of a problem with zirconia implants. The trick is to get a surgeon who's going to put a zirconia implant in your jawbone without using graft material. We're back to the graft material problem, aren't we? Therein lies the problem. Now, the zirconia implants, they don't seem to upset the immune system as much as the metal implants do or as the bone graft material does. But the only studies that have been done on these zirconia implants were sponsored by the companies that make the zirconia implants. So we're going to have to wait another 5-10 years probably to see what were the results of all these zirconia implants being put in. I wouldn't risk it, but you might want to now that you know what the risks are. So again, it's a free country. If you think you must have an implant, zirconia implant might be the way to go. Well, so that's our discussion for implants today. Again, my purpose is not to bash dentistry, but to give you both sides of the story so that you can make an informed decision about what you should have put in your mouth. Oh, and of course, there's people going to say, but wait a minute, if I don't put an implant in, what will I do? Well, that depends on which tooth is missing. If you have two sides on either side of the tooth that's missing, you can put a bridge. And if you don't want to do that, you can put a little partial denture. That's a piece of plastic that comes in and out. We use plastics for everything in life today. So there's all kinds of options that can be done short of placing an implant. I don't want people to think, you should go around toothless. That's for sure. We need all of our teeth, and we need all of our teeth to eat and to chew and give the body a sense of completion. That's called proprioception. But seriously look at implants and look at whether or not your own medical history has been pristine, or have you had quite a few bumps in the road and maybe an implant is not what you would want to put in your body right now to suppress and give your immune system more work to do. So that's my conversation today for implants, and I'll see you next time. Thank you. If you enjoyed this little mini lecture, I invite you to come and check our website. Check it frequently because we're always adding new